In the summer of 1976, a mysterious epidemic suddenly struck two Central African towns, killing the majority of its victims. Medical researchers suspected the deadly Marburg virus to be the culprit. But what they saw in microscope images was an entirely new pathogen, which would be named after the nearby Ebola River. Like yellow fever or dengue, the disease caused by the Ebola virus is a severe type of hemorrhagic fever, but the virus itself is not what kills Ebola victims. Instead, the mounting cell deaths trigger an immune system overload known as a cytokine storm, an explosion of immune responses that damages blood vessels, causing both internal and external bleeding.
Blood splattered and limp, too weak to hold up his head. A nurse struggles under the weight of a desperately ill patient. The nurse agreeing to wear a camera to give us a glimpse of the bleak reality he witnesses daily, here at this government-run treatment center. Today, the nurse managed to get this patient to drink water. It's a small victory.
These clips give us a glimpse into what Ebola is and the damage it does to many lives around the world. It was and is a devastating disease, and the biggest repercussions of the outbreak can be found in West Africa. A lot of times when we look into this deadly virus, we fail to realize that the people affected are real people with real lives. They have stories and were affected in different ways by Ebola.
Austin was one of 360 health workers in Liberia to get infected with the Ebola virus. He was doing his job and treating patients in the hospital. He gave medicine to a patient in the emergency room without knowing that man was infected with Ebola. Later that day, Austin found out that the man had died. Austin said from that very moment he heard this, he quickly went to the hospital and reported himself, informing his colleagues that he had contact with the Ebola patient. He was admitted into the Ebola treatment unit. Austin was in the unit for 20 days before receiving the good news that he tested negative for Ebola, and he was added to the discharge list. Soon after he got the news, he called his family and friends to tell them, "I will never forget that phone call. I was just so happy." Since Austin's time in the Ebola Treatment Center, he has been working as an expert patient trainer. He is able to help people who have survived Ebola, and he is able to train healthcare workers to better treat people with Ebola. Getting rid of Ebola takes more than just health workers. There are many people involved in treating this virus. There are many Ebola heroes that Sierra Leone acknowledges are important in fighting back against this deadly virus. Almeme is one of the 5 heroes needed. He is a hospital cleaner. He is one of 11 people on a cleaning team in a hospital in Freetown. He and his team work hard to keep the hospital safe for the patients and staff who move through. For him, this job lets him help his sisters and brothers in Sierra Leone so that they can get rid of Ebola and live a normal life. Fatama is a burial worker for the Red Cross team. She has volunteered to bury the bodies of Ebola victims. This is a very dangerous role to play. Some days, her team can bury up to 10 people. She is the mother of 2 children, and they keep her going. She wants to see her country beat this disease and provide a better life for her children. Yaima is a young child, but she still plays a vital role in beating the virus. Her and her friends, as well as hundreds of other children, spread the message about Ebola around their town. They help to spot symptoms and prevent people from passing it on. Bilakisu is a caregiver in a hospital. In one of her first weeks as a nurse, she contracted Ebola, but fortunately she survived. This gives her the ability to inspire others with the virus and better empathize with them as they journey through this hard time. All of these people play vital roles in getting rid of Ebola in their communities, and their stories deserve to be told.
We interrupt this programming for some breaking news. The Ebola virus still exists, and apparently no one is talking about it. Why? Well, to put it frankly, it seems that no one knows about it or cares to. I'm Michaela Steiner with Global Issues News 1, here to tell you why media coverage of global issues is often misleading. Remember the Ebola scare of 2014 here in the US, otherwise known as Fearbola? Why is it that everyone heard about the virus then, causing an almost nationwide panic of sorts, and yet the virus, which is very much still prevalent today, gets absolutely no media coverage? Whether we like it or not, news and the media are not in place to serve the people. Media is simply a form of propaganda and entertainment. It is a form of propaganda that thrives on the drama created by their narrow fields to bring in income to the corporation. Because of this, things are often blown out of proportion in the media for the public interest factor of the information. Media is only going to cover information as long as people are listening and are interested and caring about what is being said. So why did media stop covering the issue of Ebola? In all honesty, it was because the American people stopped caring. The fear of Ebola during the panic of 2014 was actually worse than the problem itself was in the country. Because of the access to media that so many Americans have now thanks to social sites and phones, the immediate access they gained to this new information blew the problem way out of proportion. An opportunity to educate, inform, and reassure was, to a great degree, missed. Ebola dominated the headlines only when an American became infected. This whole debacle in the news only lasted a year, when one young man, Duncan, died in an isolation unit. And then, as quickly as it exploded, the Ebola crisis in the US petered out. 2 months after Duncan's death, the only other death on US soil was by a surgeon who had caught the disease while working in Sierra Leone. No other infected West Africans ever entered the country, despite what people were saying and what was circulating around news stations. Dr. Bob Winter, a National Clinical Director for Emergency Preparedness, pointed out that more Americans have actually married Kim Kardashian than have had Ebola in the United States. This is Michaela Steiner. Have a good night.
Ebola didn't just affect the bodies of the victims, but also the global community. So what exactly was the response to Ebola when the whole globe seemed to freak out about this epidemic?
2 years ago, on September 19, 2014, the United Nations responded to its first ever UN Emergency Health Mission. The committee was overseen by the World Health Organization under the head of mission, Peter John Goff. On May 6, 2015, there were reported cases of Ebola amounting to 3,589 cases, a death toll of over 2,300 cases. This could not go on. The United Nations decided to form together a committee that would respond to this crisis involving some of the greatest and power countries in the world. China was one other country that really stepped up in defeating Ebola. They sent an emergency package of about $16.3 billion worth of aid to Sierra Leone. They also prepared and dispatched 300 medical workers to the area most affected. China was not the only one who stepped up in this instance. Cuba as well trained over 400 World Health Organization workers and sent them to Sierra Leone as well. The biggest contributor to fighting this disease in the 3 hardest hit countries of West Africa was the United States. The United States sent over $921 million of aid and treatment centers to the 3 hardest hit countries, Sierra Leone, Liberia, and Guinea. During this time, they also conducted a strategy to defeat this disease. They had 4 main points within this. The first one was to identify and control the disease exactly where it had started in each 3 of these countries. The second one was to minimize the secondary effects that had started up on the victim's body as well as areas around it. The third one was to successfully lead a large international response in defeating Ebola. We can already see the effects of this by previously mentioning Cuba and China as also contributors to stepping up into fighting this disease. The last point was to start a better and stronger healthcare system in these 3 countries, not only just to fight Ebola, but also to prevent such a disaster from ever happening again. A lot of the money that was given to these countries that were hit the hardest, like Sierra Leone, Guinea, and Liberia, went to treatment centers for Ebola. However, there were many treatment centers that were built, but by the time they were built, many of the victims had already died or the disease had moved out of that area, thus leaving an empty building and extra supplies. A lot of money was wasted in these areas. However, the good things that have come out of the global response from powerhouse countries such as China and the United States is the potential for all these countries to have a better healthcare system and prevent this disease from ever spreading or starting up again further in West Africa.